Every month, that Medicare Part B premium comes out of Walter's Social Security check. About $200, gone before it lands. He assumed that was simply the price of Medicare, the same for everyone. What nobody told him? On his income, there are programs that could pay that premium for him entirely, and he'd been eligible for years without knowing it. Today, in plain English, the Medicare Savings Programs and Extra Help, the assistance most people who qualify never claim. No catch, no scare story. Just money you may be leaving on the table. Let me say this clearly up front. These are real, official programs, not a scam and not charity. They exist precisely so that a fixed income doesn't get eaten alive by Medicare costs. The problem isn't that they're hard to use, it's that hardly anyone knows to ask. So let's fix that. Start with the big one, the Medicare Savings Programs, often just called MSPs. These are run through your state, and depending on your income and savings, they can pay your Part B premium, that $200 a month line item, and in some cases, your deductibles and copays too. There are a few levels. The most generous one, often called QMB, can cover your Part B premium plus most of your out-of-pocket costs. A middle level pays your Part B premium because your income is a little higher. And a third level does the same on a first-come basis. You don't need to memorize the initials. You just need to know that more than one door exists, and they open at different income levels. The second program is Extra Help, sometimes called the Low-Income Subsidy. This one is about your prescriptions, your Part D drug costs. Extra Help can dramatically lower what you pay for your medications. Smaller premiums, smaller copays, and it closes a lot of the gap people fear with drug coverage. And here's something useful. In many cases, if you qualify for one of the Medicare Savings Programs, you're automatically signed up for Extra Help too. One application can quietly unlock the other. Now, here's the part that matters most, and it's why Walter missed out for so long. Eligibility is based on your income and your assets, and the limits change every year and vary by state, so the exact numbers aren't something to take from a video. What I can tell you is that the limits are higher than most people assume, and many who'd qualify never apply because they're sure they earn too much, or they think asking is somehow asking for a handout. It isn't. It's a program you've already helped pay for. To be fair, not everyone will qualify. These are genuinely for people with limited income and resources, and if you're comfortably above the lines, they're not for you. But the cost of checking is one phone call, and the upside is real money back in your check every single month. When the downside is a few minutes and the upside is a couple $1,000s a year, it's worth finding out for certain rather than assuming. So here's the one simple thing to do. Don't disqualify yourself in your own head. Actually check. Because the limits are higher than people think, the only way to really know is to apply or ask, not to guess. If your income is modest, treat this as your next task, not a maybe. And you don't have to figure out which program, which level, or which form on your own. Call your state health insurance assistance program, the SHIP counselors, through 1-800 Medicare, and they'll screen you for all of it, for free, with nothing to sell you. For Extra Help specifically, you can also apply through Social Security. One conversation can tell you, in minutes, whether you've been overpaying. So, I'm curious, had you ever heard of the Medicare Savings Programs before today? Or is this the first time? Tell me in the comments. Honestly, just spreading the word helps someone's parent or neighbors stop overpaying. I read every reply. If this might help you or someone you love, subscribe and pass it along. We make Medicare make sense, one decision at a time. This is general information, not advice, and we're not affiliated with Medicare. Income limits and rules change every year, so always check your own situation. I'm really glad you're here. I'll see you in the next one.